Sorry, there was a technical glitch. So, where was I? Okay, so um, this figure in 2017 is an analysis of your successive changes in cardiac output and right atrial pressure once the large arteriovenous fistula is being opened. So as you can see here, the red line are the normal red curves. So it represents your venous return and your cardiac output at the normal level of 5 ml per minute with a right atrial pressure at 0. So what happens when the fistula was opened? The point A will shift to point B. At point B, there is an increase in the cardiac output of 13 ml, 13 liters per minute, and that is understandable because you have opened the fistula. And there would be an increase in the venous return, and the venous return curve shift to the right precipitously, and you can see here, and the mean systemic filling pressure also increases to 6 or 7 millimeters mercury, while your right atrial pressure is at 3 millimeters mercury. And then 1 minute after opening the fistula at point C, the curve shift from point B to point C. There is further increase in the cardiac output to 16, and while the right atrial pressure also increases at 4 millimeters mercury, and the venous return further shifts to the right at this point, while your mean systemic filling pressure also increases at 9 millimeters mercury. Now, weeks after the opening of the fistula, from point C here to point D, it shows you that there's further increase in the cardiac output to what's that, 18 millimeters mercury. Okay, and the blood volume increases because of there is a slight increase in arterial pressure, sympathetic stimulation, and have both transiently reduced, and the kidney output of urine cause salt and water retention. So the mean mean systemic filling pressure here is at 12 millimeters mercury, shifting the venous return curve to another 3 millimeters mercury to the right. Okay? So there is a prolonged increased workload of the heart, and the heart hypertrophies at this point. And there is an increase in cardiac output, slight increase in the cardiac output. So point D shows that the cardiac output now is at 20 liters per minute with the right atrial pressure of plus 6 millimeters mercury. So point D is characterized by, since it is already several more weeks, then there's an increase in blood volume, there's increase in the cardiac output, and this prolonged increase in cardiac output leads to hypertrophy of the heart muscles, and therefore hypertrophy increased cardiac output further. So I think this is the last of this part of the lecture. And if you have questions, you can call me. Okay? Meron pa palang last slide. I'm sorry. So the methods for measuring cardiac output are the following. Pulsatile output measured through electromagnetic ultrasonic flow meter, measurement of cardiac output using oxygen Fick principle, indicator dilution method. You can read that from your book, but uh, the one thing though is echocardiography. This is a very handy tool for cardiologists and for doctors. Because echocardiography is easy to do. You will just put the transducer on the transthoracic of the patient, and you're able to see a lot of things like the cardiac anatomy. You're able to assess the heart chamber sizes, the thickness of the wall. You're able to assess the valves and the diameters of your pulmonary artery as well as your aortic artery, and you're able to evaluate the conditions of the valves and flow velocity of the blood. You're able to assess if there are regurgitant flows and measure the flow velocity so that you can get the pressures of your left ventricle, for example. And through echocardiography, you're able to determine also if there are congenital abnormalities and anomalies, And if you need a further interrogation, you can proceed to transesophageal echocardiography, wherein your transducer are placed into the esophagus and you get a very closer view of the heart. So I think that would end the lecture, and in about 2 to 3 days we'll be talking also about coronary artery circulation as well as heart failure in the next coming days. So, thank you so much. If you have questions, you may call me or you may search me in my Facebook and directly message me. So, I would like to end that note with this favorite verse of mine. The Lord is my shepherd, I lack nothing. So keep safe, everyone. Wear your mask, do the social distancing, and stay at home as much as possible. Thank you so much and have a good day.